standing in it. I'm not going to even worry about soaking.
The packing for you go back in it.
Yeah, I'm not even. Yeah, because it's going to be soaked with that. And if it's not, I can even pour normal saline back over the top of it when I get done.
So the packing, is that just a one-use packing in that bottle?
Well, I'll show you. We'll pull it out. And I'm probably going to need twice as much as he had because I'm twice as thin. And you want to be careful. And like I said, I cleaned and sterilized these scissors before I came in. And you'll probably pull out just a little more than you need. And you want to cut it. And some people actually leave it sitting outside that box. And you gotta remember, it's sterile right now. It's going to be clean. And see, actually, you notice I kind of caught that edge. That'll you always know kind of where it's at, that you need to cut that edge off because it's going to be hanging out here dirty. So don't use that if you do it. Most people do that right there so they can catch the edge. It'll be easier to catch.
So about 18 inches there.
And you're going to use less and less
Yeah,
as it heals. One of those.
It's
That
gonna be.
really soaks up because look how tiny that is now and how big it was when it came out.
But he used
I use
bigger
half-inch.
stuff.
This is quarter-inch, so
Yeah.
we're using a
Okay.
different
I
size.
see.
So basically, you're going to hold it up. And you're going to pack it down in there.
Make sure it gets.
Yeah, everywhere.
Back around
Yeah.
against
And
the side.
like I said, and the thing is, it'll be loose and loose. Okay.
And don't hurt me either, Becky. What's going to be interesting is when I have to do this myself when I'm out on the road.
You can do it. I'd probably rather do it myself than have someone else do it.
I trust
See,
you
we're
guys.
just
to
kinda-
learn.
Me, but
And you're just kind of laying it in there. If you notice, I'm laying it back and forth.
yeah.
Like I said, if for some reason I didn't have enough here or something, I wouldn't put more on top of it.
It'd be easier, I guess, to cut off extra.
Pull it out and yeah. Because the thing is, you don't want to take a chance in having some in there and forgetting it and leaving it. Because then, yeah, you're just talking infection, having to cut it out, and who knows how ugly that will get.
And it's my leg, remember that too. It's the one who loves you. It's his leg.
The leg is up.
So don't screw up.
Like I said, see, this isn't packed near as tight as he packed it yesterday. Usually the first one, the surgical, because everything is dead, I mean, you can just pack the crap out of it. See, I almost...
That lidocaine that he uses, is that like they use when you go to the dentist?
Uh-huh.
Is that
Or
over-the-counter
Novocaine.
lidocaine cream? Would that help any at all to just kind of rub it around or anything?
No, you probably won't recommend.
No.
No.
And yeah, and the thing is, you don't want to rub anything around there.
Right.
Yeah, getting...
Yeah, no, I wasn't thinking.
Yeah.
It didn't hurt near as bad going in as it did coming out. And it really didn't hurt coming out.
yeah.
It just kind of stung.
Yeah.
So that wasn't bad at all.
So, I noticed
So let it
there
dry.
was-
Let it dry, and us yanking on it, and it's going, be about the same as it was. What was your question?
I was just wondering if, should I clean around that? I noticed there was some dried stuff like that.
You can clean around it like without an alcohol pad or something if you want. But basically, covering it.
Yeah, that's good stuff there. So I used to use my coach
Yeah.
girls softball. I used to, and they wanted the pretty colors, so we got it at the veterinary clinic.
Yep. Yeah, you can get it at. I'm pretty sure you can get it. I know you can get it at drugstores. I think you can get it at Walmart even. There you go.
So are you keeping
Keep that leg up. Alright. Now this is not a sterile procedure. It was in the very first time when we changed it, when we done it yesterday.
I mean, that's
It is
okay
a
to
clean.
set out.
It is a clean procedure now. And well, the thing is. Okay, here you go. Set it down.
What about when he takes a shower or something? Does he need to not get that wet at all?
Well, it definitely needs to stay as dry as possible.
Put a trash bag on your leg or something?
When I had my knee replaced, I'd take a bread sack and cut the end out of it, and then I'd just tape it top and
Yeah,
bottom.
top and bottom.
Yeah. That's pretty much all there is to it. Really not much. So
Just clean,
Gauze.
clean.
long Q-tips, right? And yeah, it's just a clean procedure. It's not necessarily a sterile, but you definitely want as clean as possible.
It looks better.
You don't really even need the syringe. You can pretty much just kind of pour it on there. Or
Yep.
Dribble it on
Yep. Yeah, I just said just things to, just to watch out for. Things you don't want to touch, like, once you get this open, don't be touching or have it touch anything. Your iota form, you gotta be careful, make sure it don't get touched or anything really by anything else. I'm gonna leave this with you.
About
1/2 inch is the best. Now, when you get smaller and starts to heal, you might want to go to the quarter. What I would do is I probably wouldn't use this maybe until the very end. If you can go and get some that's 1/2 inch, I use 1/2 inch right for